Should terminally ill patients be allowed to utilize euthanasia? That is the question at hand. Many experts say yes. Incredibly sick patients, many of whom are burdened with incurable diseases, should be allowed to choose how and when they pass. It gets to a point in which a patient is tired of it all the medication, of continued stays in hospitals, of not spending enough time with their families because their illness inhibits them from doing anything worth living. Basically, they're tired of life in general. With the life expectancy for terminally ill patients already averaging close to 6 months or less, is it not wise to let them choose the manner in which they leave the earth? Many believe yes. When discussing physician-assisted suicide, it's important to note the financial situation for families. The longer and longer a terminally ill patient stays in the hospital, the more money their family is spending. Financial burdens combined with the slow death of a loved one can take its toll on a family, and rightfully so. Euthanasia makes it possible for terminally ill patients to die a painless death and alleviates at least some of the burden their family must be feeling. Another subject matter brought up when discussing euthanasia is the physician's hand in it. A doctor assisting in a terminally ill patient's decision to die under no circumstance means that the patient is not receiving the optimal care. On the contrary, it shows that the doctor has respect for their patient's choice. It comes to a point when there is nothing that can be done to alleviate one's pain. Allowing a patient autonomy gives them a chance to die with dignity, rather than suffering through long days and tiring nights. Autonomy in choosing how and when you leave the physical world allows a terminally ill patient to die with a sense of dignity, meaning they die without the loss of their physical and mental capabilities. They can say goodbye to their families, they can go to one last church meeting, whatever it may be. Just recently, 14-year-old Jerica Bolin decided to end her treatment for type 2 spinal muscular dystrophy, an incurable disease that had left her on an endless cycle of pain since birth. She, unlike many others who decide to utilize euthanasia, only chose to forego the machines and medicines that were keeping her alive. She took no pills to advance her death. On September 22, 2016, Bolin passed peacefully, in what I imagine to be a very difficult situation for every parent. Her mother, Jennifer Bolin, in response to critics, stated that, "My only words to anyone questioning this is that I love my girl with every cell in my being, and no one in their right mind would let someone suffer like she was."